Well, my left neck has been hurting for the past 2 months, and it's actually been moving down to my arm. I've been having like a burning sensation going to my thumb, my second and third fingers. It's constant. It's coming like maybe 7-8 times a day. I noticed like my neck kind of went one way like 2 months ago, and ever since then I've been having like this burning, tingling sensation to pretty much these 3 fingers. And on top I have some back pain, and I noticed I have some TMJ too. Like I feel like a clicking when I go up and down. So I have a lot of wear and tear on my body over the years, and I notice also my fingers sometimes will contract. Sometimes my fingers get jammed, like they'll just kind of clench up like that. So I want to just make sure my wrists are okay, my TMJ, and then also this neck pain. The neck is really the big issue on the left side.
All right. Can you show me your hands? Okay, so see, I'm already starting to see some issues already. It's like I want to see the muscle integrity. I don't want to see an atrophy going on. You feel that difference over here? See,
yeah.
This is nice and meaty over here. Feel that? Look at that. This is softer here. This muscle, this thenar pad over here. See, this is atrophied. And that's what caught my eye right off the bat. See, your palmar surface is already slightly atrophied here too. See, I'm checking your first dorsal nerve. The T1 nerve, it innervates, goes way deep inside. Slightly atrophied in there too. Do me a favor, can you grab your fingers like this, very tight? See, his pinky finger, see, it's nice and firm and tight. Ring finger's tight. See, the middle finger, see, there's a little give. More so on, which side would you feel is weaker?
The left.
What about this one? See, he's trembling.
Yeah, also I feel the left.
Left as well, right?
Yeah.
So you're trembling over here. That tells me no, this is like, the nerves, they're struggling to maintain the muscles. The muscle itself is trying to get more nerve function to it, but it's struggling. That's why it's like it's spasming a little bit. Okay? Go with your thumbs like this. Okay. Push out as hard as you can. Feel that difference right there?
Yeah.
Right? Which one's stronger?
This one.
The right one, huh? Okay, push out again. No, both fingers. Yeah, see? Even your thumbs are weaker. All right. So clearly there is a neurological problem going on in there, and we're going to take a look, see what else is going on. Right?
Okay.
So during our consultation and also through the history, he was talking about that he's a PA doing ortho surgery, all that stuff, and from time to time, you would have those contractures, like a Dupuytren contractures going on in your hands, correct? Right. So it's spazzing up and it's having a lot of tough time, doing, assisting and helping with all those surgeries over there. So by taking a quick glance at that X-ray over there, I see several DKDs going on in the neck over here. But the more important question is, okay, what caused that? All right. So now, I don't want to take just like a very tunnel vision view and take a look just only at the neck itself. No, something must have been unstable somewhere below to cause that problem. So that's what I'm going to focus, take a look at what's going on in his foundation, his mid-back, and everything else, what caused that domino effect. So we're going to start with the instrumentation over here. And the purpose of this device is to look for that inflammatory process, because I already see upon visualization alone, I'm seeing swelling over here. I'm also seeing swelling in the mid-back over here, and swelling down here in the low back. And this device is going to help confirm my hunches over here. See, we got one reading over here. So you can see it. See, it's all pulled with fluid. A lot of fluid over here. There's a lot of fluid down here. And I see something also puffing fluid on the left-hand side of that secret that joint. So, let's take a look, see what's going on with that fella. Yeah, we got that reading over there too. Okay, so that one point to the right. So it's very subtle. Most likely this is a compensation turned into subluxation over there. Meaning the body was trying to adapt to the biomechanical instability and it was unable to do so. And because it's such a long-standing chronic problem, eventually that compensation turned into a subluxation, meaning a bone that misaligns and start reducing that nerve function. The body's not functioning as well at an optimal level as well as it should. So we got another fellow right there. And as you can also see all this, this is all muscle spasms and swelling. A lot of it all around here as well. How's that fellow right there? Tender?
Yeah, I feel a little bit.
Yeah. It's all puffy in here. All along the secret in that joint, so much edema here. Not too bad here, eh? Yeah, see,
Yeah, it's clean bad there.
See, and I motion palpate. See, this thing's moving just fine. Sacred is moving just fine. But see, this left ilium right here, it's a brick wall. It's just not moving. That's not a happy camper. How's that feel right there?
I can feel just a little bit there.
Yeah, right? Yeah. See what's going on with this fourth lumbar. How's this fella right there?
Yeah, it's so tender.
Yeah, it's not that great either. How's this fella right here?
I feel a little bit of pain on my left side in there.
Yeah, see, it's also fixated. It's not moving over here. And I expected the next compensation biomechanically is over here. That failed to
Yeah, I can
adapt.
feel that.
Tender right there,
Yeah.
huh? Well, another thing I'm seeing, I'll touch base on that in a moment on the x-rays, that your AC joints are unstable. And it's come from here. How's that fellow right there?
Not bad.
You sure about that?
Oh, yeah, no, yeah, I can feel that now.
Yeah, that's 6 cervical. That's in trouble. See, I can't touch your head at all to the left. Everything else is just hunky-dory fine. Okay. We start off looking over here. This pelvis itself, right off the bat, on your left side, okay, it's instead of being leveled, it's already tilted this direction. All right? In addition to, I'm also seeing your sacrum itself. It's anterior. It tilted forward. I like to see it more of a 45-degree angle over here, but no, it went a little bit forward. As a result, that's what we're starting to see this hyperlordosis of the lumbars, hyperkyphosis of the mid-dorsals, and then your neck starts straightening out. And actually, it's starting to go a little opposite direction over here, right? Another thing I'm seeing here on the pelvis, okay, is that the width. I wanted these fellows to be symmetrical, same size.
Mm-hmm.
This was much more narrow, more blade-like, and this is wider. So the reason why it's doing that is if we look from the rear, if this fellow is rotated like this, what happens? This doing becomes a little more blade-like.
Right.
Okay? As though it becomes much more narrow. So if we look from the front, just like that, okay, that's where we see that X-ray projection itself.
Right.
This one becomes much more narrow in view. So when we have an external rotation of the pelvis itself, all right, that's what in the textbook it clearly shows biomechanical is going to make this hyperlordosis, kyphosis, and supposed to have a hyperlordosis in the neck. However, okay, because of 2 gyroscopes in our brain, okay, our cerebellum and the eye-riding reflex, the head itself, because the whole entire spine, basically what's going on is you got this rotation over here. But if we did not have that compensation, as in, if we didn't have those 2 gyroscopes, we would go way over like this. And we can't walk this way at all. All right? So what your body started doing immediately is over here, it kind of rotated. Instead of following along the right foot this way, no. It went this direction. All right? So that's what I'm starting to see over here. But this hip itself, I want to see it like this. But instead, that's what I'm seeing over there, it went opposite direction immediately. All right? So, but here's the thing. When we start rotating from here, hips this way, kind of rotating this way, it still doesn't help because our now head's this way. Okay? So our bodies are recompensating here. And then from here, compensate this way. That way. That way. That way. So it keeps on compensating left, right, and tilting all different axes. Just try to keep this thing level.
Right.
So that's why we started to notice that for your neck over here, okay, it doesn't like being twisted like this, right? So that's why no matter what I try to do, addressing it in the mid back, what's gonna happen? It's gonna sling right back here. So your brain and your body says, hey, what the hell's going on over here?
Right.
I don't want the brain and the spinal cord to be all twisted like this. So what's gonna happen is that it's gonna try to counter-rotate a bit to try to alleviate this tension
Okay.
in the mid back,
Right.
in the mid, this region over here. That's why your cervical curve is not going opposite direction. This is like a final circuit breaker to protect the brainstem and the spinal cord.
Okay.
Okay. However, that was also explaining why you've been having those neurological problems in your fingers and your hands, because bingo, we got a nice little DJD going on over here, this breakdown. Because all of that purpose is try to protect that brainstem and spinal cord, it's affecting here. And just like the final straw broke the camel's back, it's steadily breaking down.
Okay.
Okay, and it's not designed to do that. It goes from here, your neck, okay, supposed to have some movement over here.
Mm-hmm.
But no, now it's just like, okay, it's getting too much movement over there and it's grinding away.
Oh wow.
So that's why you start to notice that, hey, what the heck is going on over here? It's too unstable. All the muscles in your neck go whack, and they clench up.
All right.
So that's what you may notice. It's like, okay, we're really tightening up. In addition to your neck over here, I'm gonna see these two bones level.
Mm-hmm.
That bone right over there, it's tilted this direction.
Oh.
All right, it's a little easy to see over there.
Right.
And it seems to over here, in this upper dorsal over here, because biomechanically it got a little rotated and leveling out like this, you start to biomechanically affect also your AC joints. See the AC joint gap? It's a little wider than it should be.
Oh wow. Okay.
So I wouldn't be surprised you don't have to feel some shoulder discomfort as well.
I do. I have
All right? Yeah, exactly. So everything's all biomechanically connected. So what we need to address is, no, I gotta adjust this one over here. Now, a good tip for the Gonstead students and young docs over there is that this. Now, textbook-wise, typically we would do a EX pull maneuver. But because the way the spine is already, his lumbar spine is rotated this way, if we do that pull maneuver, okay, it's gonna rotate the spine even more this way. That's what we wanna avoid. So instead, I gotta do a push maneuver. So we're gonna knock out two birds with one stone. By adjusting it in the center line this way, it's gonna cause also the rest of the spine to start centering out as well. And that's the approach we're gonna take with this fellow over here. And in addition to, because your femur headline, I wanna level like here, but it says over here. So when we address that EX, it's gonna level it up.
Okay.
So that's the battle plan. I'm gonna address this one over here. I'm gonna double check what's going on over here, here, and there. Tell me, what's different?
Feels more looser.
How's your neck?
Oh wow.
Oh wow, what?
I could turn now. To the left or right. I wasn't able to do that before.
Okay. Give me your fingers. Curl them. Okay. What's different about it now?
I have more strength. Like it feels almost equal almost right now. It feels the same.
See, your middle finger is still spazzing a little bit. Your index finger, see this one, your left one?
Yeah.
It's still spazzing a little bit.
I can feel it like starting to clamp up a little bit, but I feel the strength is a little bit stronger now.
How much stronger would you say right now?
I felt like before it was maybe a 5, now it's probably an 8 or 9.
Nice,
Yeah.
nice. So that's what we're talking about before. Famously in the entire Pisa, your left hip was actually the original old problem that winded up your entire spine.
Wow.
All the way straight up to your neck. That's what I was talking before. You know, you can't have a tunnel vision looking at just at the DJD at your neck itself. No, I have to trace to the original problem, and that's what started the whole domino effect. What? Ah!
Oh.
Relax shoulders.
No.
There it is.
Oh.
What up?
Oh. Fuck that one.
Okay. Now, feedback.
I felt this like this. My hand opened up. It felt like I got power back. Like it was restoring when you adjusted me there when you pushed down my. I don't know which one it was. T, whatever it was.
No, 6 cervical.
6 cervical. So I felt that one. That was really, really strong.
Give me your hands. Okay, see, your thenar pads are still slightly atrophied. It's going to take a while to strengthen these up here. Your hands. Curl them up. Tell me, what's different about them?
They're not spasming anymore.
Not spasming anymore?
No.
How's the strength?
Feels better. Much better.
Nice. Okay. Elbows are fine. Radius is fine. You only slightly out. Not too bad. But feel this? This is out. Set this.
Oh.
There it is. See if your fingers are out. Hold on. There. So you've been operating too much there, man.
Yeah. Yeah. Oh.
You better get these surgical hands back in action there, man.
Yeah.
Yeah, this is out. There it is.
Oh.
Slightly out. There it is. There's that fella.
Oh, better.
Hold on a second there. You're gonna get your tip-top condition back in the order, huh?
Oh.
There it is. Now try the fingers. See how I like them.
Yeah, feels way better. Way better. Feels normal now.
Open, close. All right. That's that. Open, close, close, open, close, open, close, open, close, close. Good. Good. Open and close your mouth. How do you like it? Slightly out. Open, close. There we go. Open, close, open, close, open. Okay, try again.
Feels better.
Good. Now here's
I still
this.
feel it clicking, but
It does because
better.
a couple of reasons why. Number one, okay, we didn't fully restore the biomechanics of your spine yet. We unwinded quite a bit of your spine, but not completely.
Right.
So therefore, wherever your head's gonna rotate, your jaw's gonna follow along for the ride as well.
Okay.
Another thing as well, because that's a long-standing chronic problem, just like a patio screen door that jumped a track, okay, and you're still using the patio screen door, what's gonna happen to the groove? It's gonna wear it out. So it's gonna take a few months for your body to regrow the grooves in your TMJ joint itself. To speed up the process, I recommend vitamin C and collagen.
Okay.
All right? Okay?
All right.
That's what it's all about, brother.
All right. Thanks a lot. Appreciate it.
You're very welcome. Okay, I'll see you next time.
Yeah. Take care.
All right. Give us the latest updates. How's everything coming along with that left hand?
So it got better. It was like an 8-9 when I first saw you last week. Now it's about like a 4 or 5.
Nice.
So it's kind of almost like 50%.
Great. Let's show to the video what's going on with the hand. Okay. Yeah. Let's go check this. Yeah. Strength's starting to come back. It's still some weakness here.
Right.
But yeah, we're progressing very, very well. All right. All right, so give us the latest updates. How's everything coming along?
So I'm feeling better. I used to have these 3 fingers, but now the thumb has stopped like a few days ago. I don't get any more, like I was getting those paresthesias, burning, shooting pain down to all 3, but now I don't feel the thumb anymore. It's just these 2 fingers really.
So the thumb is completely resolved.
Yeah.
And now it's just these 2 that's affected.
Yeah, and it's like about 3, 4. It's better. When I came to you first, I think it was like a 9 almost to 10.
All right, so 60% improvement overall. Hey, that's a great job.
Yeah.
All right, thanks for the updates.
Yeah, thank you.